At the state level, the Ohio Department of Health released its recommendations for what schools should do if there's COVID in the classroom. All new tonight at 11, 10 TV's Olivia Eugenio breaks down the new guidelines and explains why experts are saying masking kids is so important.
The country has seen a surge of COVID-19 cases following the Delta variant. But how has that impacted kids? The American Academy of Pediatrics said this week COVID cases in kids jumped 84% in just 1 week.
We've definitely seen an increase in cases with the Delta variant. We know that it's much more highly transmissible.
So what should schools do if there's a COVID exposure in the classroom? ODH released its guidance Thursday. ODH says quarantine is not necessary if everyone is required to wear a mask regardless of vaccine status, if there's physical distancing, and if COVID prevention policies such as cleaning protocols are in place. If those guidelines aren't followed, then fully vaccinated individuals do not need to quarantine so long as they wear a mask indoors for 14 days or get a negative COVID test after 3 to 5 days. But if a student or staff member is unvaccinated, then ODH says those exposed should quarantine unless that person was wearing a face mask and was physically distant.
We don't want to inhibit their education. That's the first thing that's so important about being in school in person. It's having that contact with your peers, with teachers.
So what's the best way to slow the spread? Doctors say follow CDC guidance and make sure kids wear masks.
It is the best way for prevention of transmission of disease that we have right now.
Dr. Pugh also says if your child is sick, keep them home. Olivia Eugenio, 10 TV News.
Currently, only kids 12 and older are eligible for the COVID-19 vaccine.